Hi, today I'm going to show you how to do trigger point therapy on the back. First, we start with compressions. Okay, so we start compressions on the shoulders, and I'm basically walking with my palms, with the tip of my palms, and of course I'm using my body weight. So the stand should be one leg in the back, one leg in the front, and slowly go to the hip area. One hand here, one hand on the hip. Once, 2, 3, 4. Then transition to the other side. Each part just gets one deep compression. Okay, a little bit on the shoulders, and ready to undrape. So here's the undraping part. So we open sheets with the blanket, go all the way down, grab the sheet part and tuck it under, and then grab the sheet part, grab it and tuck it under. If there are hands on the way, you move it a little bit to the sides, so that way you get to tuck more sheet under. So now we have secured area, and it won't come off because it's pretty sturdy. Okay, so now first to make sure you apply oil on your shoulder, on your elbows and forearms. So make sure there's enough oil, and then apply oil really quick on their back. So this is just like light effleurage, making sure the working area is ready to work on. So you get oil, and light to, actually medium to deep effleurage while you're applying oil, but pretty quick. Okay, so the area is all ready. I got oil on the areas that I'm about to go deep. So that I'm doing it a couple times, but really it just has to be 1 or 2 times. Just make sure all that feels smooth, so you would avoid too much traction with the skin. So now, if you could come maybe over here. Now we're going to start with our first move, which is in the position of my legs. So here's the position of my legs. I'm getting myself comfortable into a position that I would use my body weight, actually more spread like that. Spread legs like that. And now I'm starting with the lower back. So I'm putting my elbow this way, then I turn it, and now with my body weight, this joint is locked. I'm going with pretty firm pressure over the muscles of the spine, which called erectors, and I'm trying to support with my other hand to not to slip. Then I'm going all the way down to the shoulder. So here's this part. So I'll show you again. All the way down, and I'm gonna hit all this with my elbow. I'm gonna hit all this area, go all the way down, and then with my triceps, I will go over her trapezius, go around with lighter pressure because this is scapular. We don't want to hit hard the bones. So it's coming up, is pretty tight. Okay, so one more time, same move. So that way we're trying to relax the muscles on her mid back, lower back, upper back. And you can actually, so usually you can do 2 times and go to another side, but then you can actually do second time as crossing with your body weight, you can just cross slowly, not too fast, and crossing these muscles. So that muscle go all the way like this, so you can just like cross it. So that way, by crossing and clicking that muscle, you can relax it as well. So then slow transition to the other side. So I'm going to another side, same movement, same. So supporting with my other hand, my whole torso going with me, not just my hand, not just my arm. Coming back, same move, maybe a little bit crossing up and down to see where is there tightness. And then over here, I'm trying to go slow. This is the upper back levatoscapular muscle, upper trapezius muscle. So there you go. There, that was a click. There's one trigger point. Then I'm going down. And feeling a couple more clicks. So that's the first move. Then we go towards the upper back area. Do kind of a couple deep effleurage strokes before we start working with our forearms and elbows. So now I'm starting looking for the trigger points. So the first move, the position that I'm standing, first leg in front, one leg in the front, another one in the back. Then with this hand I'm supporting myself. So my legs are supporting my body and this hand is supporting my body. So with this arm, I'm basically clicking from the spine, like from and my arm is from supine to prone, from supine position to the prone position. That's how I move my hand, my arm, and that way I'm going over her upper trap muscles. Maybe you can get closer to see. So I'm working on upper trapezius muscles, like right here. So, and my movement is from the spine to here. And I'm trying to hit these muscles with my forearm. So I'm basically going, if the hair goes on the way, you can fix it with a towel, okay? So you can, and by, I'm not pressing too much right now, I'm just looking for the clicking, but my whole body is moving forward by me flexing my knee, my front knee forward. So I'm flexing my knee forward and I'm looking for the clicking. So I feel the clicking on these guys, on upper trapezius. So you can just work on those by doing that movement. Like this is the movement. So now I'm going more to the back of her back muscles. So I'm moving towards these guys. So that's another area where typically there are a bunch of trigger points. The muscle called levatoscapular. So these were upper trapezius, now upper scapular. So the upper scapular you can work by flexing your elbow more like this, so that way the tip of your elbow is more pointy, and supporting with another hand, you go over that muscle and trying to find the click. So there is a click right here, and I'm doing this movement by moving my whole body. My torso is moving left and right, from left to the right, by flexing this knee. If you could just capture that, my legs, I'm doing that 1 2 1 2, kind of like a circular movement of my body, of my hips. So that way I am clicking with not so much pressure on my client's muscles, because this area might be a little bit sensitive because they're ribs, and so we're trying to hit those muscles with effective pressure, but at the same time not too much, so it would be too much traction with the bone, too much hitting the bones. Okay, so then you can work with your thumbs, work on that trigger point, but then of course when you finally found the click and you think that's a trigger point, and you can ask if does it feel like a trigger point, and the clients, does it feel like the tight area, does it bother you usually, and they will tell you yes. So you would find the very tip of that trigger point, and so imagine this, you feel that the tip is right here, right, the click, the clicking part, so it would feel like a little ball inside her muscle, and you would want to find the very tip which location, which direction is looking at. So imagine there's a laser line going right away from that tip. So you would place your shoulder towards that line. So it would be the same direction. Because our goal is to press with exact against that tip. So you basically right perpendicular to that muscle basically. So if the muscle is looking this way, you would press straight from that direction down. So press on it, and you would ask, does it feel like we're right on the spot? And they would say yes. And right away you ask, does it feel any, do you feel any shooting? So usually when you press on an elevator scapular, it shoots towards the neck or down to the arm. So I found the tip of the muscle, and I'm gonna ask my mom in Russian. Мам, куда-нибудь отдает?
Да.
Куда?
Лопатки, шея.
Okay, so my mom said it's going to her neck. Right away you say, okay, that's perfect. That means we're on the right spot. So right away you tell them, there's no need to worry. I mean, you don't say that there's no need to worry, but you act that you're confident. You show them that you're confident in what you're doing, and you do know that you expect that shooting to the neck, so they don't think that we're hitting the nerve. Okay, so that's one. So you say, okay, that's perfect. If you're shooting from 1 to 10 of the intensity, what number do you feel? 1 is nothing, 10 is the most painful. Let me ask my mom. Здесь?
Да.
Какой номер от 0 до 10? По...
8 может.
Okay, so my mom said it's 8, so we would release the pressure a little bit, so it would be 7. So we need to be on 7. So we adjust the pressure, make sure that it's 7, and you could tell them that that's perfect. 7 is the perfect pressure, and you would tell them what that we are on the actual trigger point. If you feel shooting and it feels like the right spot, so we are on the trigger point, and you can tell them what the trigger point is. So you stay on the spot for like 8 seconds, and then really quick do like a circle of friction, because when you work deep on the muscle, and when you let it go, you kind of want to do a kind of circle of friction, so it doesn't feel as painful anymore. So all the trigger point work, it's usually doesn't feel painful because you're working on the muscles, not on the bones. It's just intense. So that's what you can tell your clients. It's just intense work, if they would be concerned about that. And always make sure that they're okay with the pressure when you're going deep on the muscles. Okay, so as you see, this area got pink. That means we increase blood circulation in this area, so it's now muscles will heal faster and will be healing by themselves, because the blood, all the blood flow rush into this area. So with better blood flow, muscles heal faster. So now rhomboid area. So these guys depends on people's pain tolerance. So some people they actually don't can't take that much pressure. So you would go with your thumbs. Otherwise, you can go with your elbows by doing this movement. And so I'm using my whole body. Again, my knee is flexing forward, and I'm going from the scapular away from the scapula and trying to click these muscles. So usually they are hiding here. Okay, like this. My shoulder joint is locked. So, okay, there's not so much clicking, a little bit here, but it doesn't feel as bad. So I would just do a couple clickings with my thumbs. So that way we get the blood circulation in that area as well. Alright, so same thing we would do with the other side, right? We would ask, how about other side? Does it feel tight? So depending on the answer, you would focus on the one side more than another. Then you would move to their neck. Since you're already working on this area, you would just like easily can go to their neck. So if you're working on the right side, then you're standing on the right side, right? So how you work on their neck. If you could, maybe I'll show you. So you would just grab with either with both thumbs or with one thumb. Just grab the side and move up. So basically the movement would be like this, from down up, from down up, from the top of her neck all the way to the bottom. So this is the movement. Up, down, from down up, from down up. And my position, either, so my now this knee is flexing forward. And could be just like the faster movement. So I don't feel any tightness. So I would go to another side and do the same. So when there are tinier people, you would need probably, and there's tiny neck, you would probably need just one thumb. But when there are bigger bodies, bigger necks, then you would need both thumbs. So it depends on the size of the body. And so you basically, if you want to, so this 1, 2, 3, 4, 1, 2, and my thumb is in this position, so not like over extended. Okay, so this is and if we do find some tightness, we do ask, okay, do you feel, while actually you work on the neck, you can ask, is there any tightness, and yes or no, and what side bothers you more. So that's the side you would focus on, unless they told you in the beginning, so you would just confirm during the session. So then another area you would need to, so if people mention that they have headaches, you would need to pay attention at their suboccipitals. So these are the neck muscles on the base of the skull. So they're sometimes, when they're tight, so this is the way you look for them. So try to look for the click. So usually they're hiding right here, right on the base of the skull, like the direction of those muscles. They're tiny. They go like this. So you would try to do the cross fiber friction. So each trigger point, to find the tightness, you would have to, so if this is the line of the muscle, you would have to do the cross fiber friction. So that way you would need to, that is the way you would find if they're tight or not. So this is how we're looking for the trigger point on the suboccipitals. I don't see anything, I don't feel anything that tight. but you would still would need to confirm, like, do you get any headaches? Usually about the headaches we ask in the beginning of the massage, but during the massage you can ask as well. Depends what areas they would mention in the beginning. Okay, so before we transition to their lower back, I would do one deep effleurage that I just did. Shoulders, neck. Okay, and then so let's start from here. So if we would need, so there's someone that is coming with a lower back pain, that would, we would, of course, do a little bit work on their upper back and already right away go to their lower back. But if they come just like for the regular massage and the whole body is aching them, then you would just pay attention at all the parts of their body equally. Okay, so this is how we're looking for the trigger point in the lower back. So usually the trigger points are hiding in their QL muscles. So we would go, okay, we would actually see, maybe you can feel tightness with the thumbs, or you would try to feel it with your elbow. And then before you go deep and do all this crazy work on their back, intense work, you would ask, do you feel any tightness in your lower back? And if they say yes, then you would be like, is it here? So you would look for those trigger points. You would press on those trigger points that might be where they might be hiding. So this is one of them. Mom, здесь болит? Okay, so my mom has tightness in her lower back, so, and I right away put the tip of my elbow on her QL, and with this angle. This is the angle. So this is the position I'm standing, right? And with this hand, I'm supporting my elbow, and this muscle is looking this way. So this is the direction, like this way. So I'm trying to hit that against that muscle with the same angle, basically. So my shoulder is exactly the same direction where the muscle is looking at. So right here. So when I think I'm on the right spot, I would ask, does it feel like the right spot? Mom, здесь?
Немножко, да, почти там.
Здесь?
Да.
Okay. So when you ask your client, is it here? Or they would say, no, a little bit up, a little bit down. So you just adjust the pressure, just the direction. And then you confirm, is it here? Здесь?
Чуть-чуть дошла.
Okay, so I slipped a little bit.
Вот, да.
Okay, so here. So now I ask, how's the pressure, what number? Какая цифра от 0 до 10? No, I would ask about shooting. Куда-нибудь отдает?
Сейчас немножко отошла.
Okay, so I slipped a little bit. It's very easy to slip. So I would adjust.
Дальше. Вот.
Okay, right here.
Да.
Отдает?
Ногу, поясницу.
So my mom said it's going down her leg, which is typical when you work on the lower back muscles on the QL. Какой номер?
Где-то, может, 6, 7, 8.
Okay, 6, 7. Okay, perfect. Okay, and that's how you stay for 8 seconds. Okay, so after you're done working on their lower back, you would do circular friction with your palms, and then you would go smoothly transition to the other side. So the same thing. If there's nothing bothering them, you would just do deep effleurage again. So if it's not enough oil, you would just, because by this time their back is already soaked all the oil, especially with dry skin, and you would just do deep effleurage and address all the trigger points if they are located on their erectors, the mid back. Same with the other side if it needs to. And then go back and start deep effleurage. Before you end the massage, you will do deep effleurage on the shoulders, and then from the very top all the way to the bottom, you will do deep effleurage with my whole body weight. And that's how you end the back massage, by covering them with the sheet first. Wipe all the excess oil real quick, and then cover with the blanket. And that's how you do trigger point therapy on the back.